Welcome to the She Found Health Motherhood podcast and YouTube video. We are so excited today to have Stephanie Curran, who has a diploma in traditional Chinese medicine and practices acupuncture, and she lives here in beautiful Victoria, BC. She's a special interest in reproductive health, women's health, and health during the pregnancy and early postpartum period. She also does mindfulness-based stress reduction courses. We are excited to get to today's topic. We're going to be speaking of how we can use mindfulness in our transition to becoming a parent through that fourth trimester, and also how we can use it during the parenting years and in our relationships with our partner. Really important to actually get this started earlier on than postpartum and enroll in a course during pregnancy. And you can check out her courses on her website, which we'll link below. One of the big stressors we talk about is lack of sleep. Now, if you're interested in learning more about what a newborn sleep really looks like, check out our course on Newborn Sleep 101, and you can find it at our website at www.shefoundhealth.ca. Now, before we get onto the show, I just want to have a quick reminder that the She Found Health podcast is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding medical condition. The views expressed by She Found Health and our guests are not representative of any institution with which we are affiliated.
Thank you so much. I'm delighted to be here and part of this podcast and to speak about something that I care about a lot and that touches me really deeply and informs my own experience of parenting is having a mindfulness practice. And so my background with it is I've had my own personal practice for 20 some odd years now. And then through the process of trying to become pregnant, it took us a little bit and we needed extra supports to have that happen. I really found it deeply supportive through the grief and the stress and the strain of that. And then through the pregnancy and through labor and in postpartum, I really found it helpful. And now my daughter is almost 8 years old, and it still is deeply supportive and informing how I keep with my intention of how I want to show up as a parent, and be in relationship with my partner and be in relationship in community. So yeah, delighted to be here and to speak about that a bit.
Wonderful. Well, thank you. Why don't you tell us what is mindfulness? We've all heard of mindfulness, but I think unless you've actually started practicing or looked into it a little bit, not everybody knows what kind of mindfulness is and what it isn't. Would you mind going through that for us?
Yeah. So one definition of it by a fellow named John Kabat-Zinn, he started a lot of the research around mindfulness in the secular way out of the University of Massachusetts in a hospital almost 40 years ago. His working definition of mindfulness is that it's the awareness that arises from paying attention on purpose in the present moment and non-judgmentally. So there's always this orientation again and again to what's actually here now, right? To the present moment. And we have to be intentional with that, because when we look at our minds, we see that they're scary little things. They're all over the place. They're back in the past and rehashing and remembering, or they're rehearsing and planning. And so there's this orientation again and again to sort of land back right where we are. And then we do this with a lot of gentleness and a lot of kindness, because we also get to see very quickly that, of course, the mind is judging things all of the time. It's got ideas and opinions and assumptions and all of it. But the moment we wake up to seeing that we are judging is we get to see that we've put a layer over top of what the actual experience is, right? So once we see we have our expectation lens that we're looking through, we can go, oh, and then there's more information available. And there's more ability to connect. And it's one of the other things that's so beautiful about this orientation to the present moment is that's actually where we're alive, right? That's where we experience connection and joy and love. And so, yeah, that's the little bit about it. And so we can do that and be present to our internal experience, what's going on with thoughts and feelings and emotions. And we can also bring awareness to through our connection to the exterior world, through our senses. Like right now in this moment, we can be aware that we're seeing. We can be aware that there's sounds that are happening, that we're hearing. We can be aware that our feet are making contact with the ground, or some part of our body is touching the ground. And it's simple enough, right? Like, of course, we know our feet. We have feet, right? But until I said that, feet weren't there, right? And so it's just this subtle, there can be an idea that we have to try really hard, to be mindful, but it's actually already here and available at every single moment that we're in. It's just this slight, just waking up to it. Yeah. And so that's maybe a few words. Sorry, you're going to ask a question. I was going to say that's a little bit about what it is, but maybe it's also helpful to say what it's not, the opposite of it, because there's a lot of misconceptions about it. So one of the things that it's not is a religious practice. Certainly it has its roots in different cultures and traditions and religions, but we can think of mindfulness in this secular way as just how we're placing our attention and being aware of our awareness, this natural innate human capacity that all of us have. And it's also not about having a blank mind or inducing some kind of calm. We're not just putting a veneer of mindfulness over top of whatever's happening. We're actually turning towards it and leaning in towards becoming more intimate with what's actually here. And often when we go to sit or do a bit of a practice, and the mind's not quiet at all. It's busy. It's talking and nattering all of the time. But knowing that you're thinking is very different than being lost in thought. Right? That's a nuance in language, but actually the experience of it is quite different. And the experience of it for your body physiologically is enormously different. Because when we're lost in thought and we're caught in narratives like anxious thinking, right, or compulsive kind of thinking, or depressive kind of thinking, which can visit and be common visitors in postpartum, then our body is physiologically reacting like what our thoughts are saying are true. Right? Something's wrong with the baby. The baby's not okay. That puts your body into a fight or flight state, right? Whereas we can know that we're having these kinds of thoughts. Now the part of the brain is a bit more available to be able to regulate that. Right? So that's a bit about what it's not.
Great. So you've kind of spoken to how we can use it during the postpartum period. Anybody who's listened to me before knows that the postpartum period is a dramatic change in your life, especially with your first child. You have no idea what it's going to be like, and that's okay. But to many people, it is quite a shock to the system. And one of the big reasons is a few. One, you're not sleeping well. Yeah. Two, there's a lot of challenges that are actually hard. Breastfeeding is actually hard to get started for most new moms, and they don't know that going into it. So then there's these thoughts of anxiousness and failure and all of these things brought into it that just makes things even worse. So it doesn't have to be that way. You do have to be sleep deprived, and you are going to have challenges. But again, it's kind of how you approach it and how you respond to it, I guess, that can improve or worsen the situation. How would you say mindfulness could be used during the postpartum period to make it better, or to improve the experience, or to help manage those insecure thoughts, those anxious thoughts?
Mm-hmm. So one of the things that I know really helped me in my experience when I would sort of be catastrophizing, right? Like around what you said about sleep, for example. Shay was not so much of a sleeper. And so I really struggled with the intensity of being that tired. And so in the moments, you can see when you're so exhausted and tired, and then they wake up again, right? And then there's a looping of like, I'm going to lose my stuff. Like I can't do this, right? That it's almost like we were talking about in the other one with acupressure, where you're in the middle of a contraction and you're bracing against it. You're contracting against the contraction, right? There's still lots of contractions that will happen in postpartum and in parenting and in life in general, right? So first of all, it's helpful to have the awareness to realize that you're bracing against, that already sleeplessness is hard. But when there's an extra layer of suffering, when we're adding on top of it, that it's not okay. I'm not okay. What am I doing wrong? What other book do I need to read about it? What, just go to sleep. Like, and in the moments where I would be overwhelmed, and I'd have my daughter, and I'd be, like, it'd be a little bit of like a go to fucking sleep. Like, I'm trying not to swear with the go to sleep bit, right? But it's like that kind of intensity, right? It's like you're just at your end of your end, right? And that's not the way I want to be in relationship with my daughter. And also, these little beings are highly attuning to our own nervous system. And so that kind of energy is not going to support the attunement such that she's likely to fall asleep well. And so for me, I really found it so deeply helpful to realize when I was adding on to more suffering of the experience, when I could soften into compassion of like, this is so hard right now. Do you see how that's different than go to sleep? It's totally a different experience, because as I'm softening into my own, this is hard, I'm able to embrace that it's hard for this little being that I'm holding as well, right? And so there's more availability for this attunement and co-regulation together.
Yeah, so true. And also with your partner.
Yes.
And
Yes.
and vice versa.
Yes. And then also me being aware of when I would have, some kind of storyline of like, how can you be sleeping through this? Like, and then being mad at him and then punishing him later because of whatever else I had going on about it. Right. So I found it really helpful in how I was able to communicate with my partner, and not all the time. Like, and of course I would have my moments where I lose it a bit, and it's, yeah, she's 8. I still have my moments, right? But there's so much support for me in feeling it, being able to feel it rising in my body, as opposed to not having that connection, and then all of a sudden stuff's just flying out of my mouth, right? So this is, you named this with your wording of responding versus reacting. Because between any stimulus, whether it's a cry or whether it's something with your partner, or it's whatever is happening, that there's a stimulus, and then there's a space always between either reacting or responding. And if we can attune to that pause, which mindfulness very much helps support and grow that muscle of seeing that there's a pause, then there's an opportunity to choose how you're going to respond, as opposed to this happens and boom, this comes out of your mouth, right? Like for me in parenting, for example, if I can start to be aware that my tongue is starting to press on the roof of my mouth, then I know that I'm about to get angry, right? And I can take a breath, I can take a little bit of space, I can ask for my partner to step in, like, I just need to go cool off over there. And then be better able to respond, as opposed to missing that cue that's even happening in my body, and then flipping my lid,
Yeah, and for anybody with toddlers, or,
yes.
well, I think all the way to young adults, old adults, as
Totally.
children, we all get triggered and we all get frustrated.
Yeah.
And I think it's hard for us as parents to look at why our children are acting the way they are, as opposed to just looking at their actions.
Yes.
And so mindfulness would allow you to just have that pause, think about what's actually going on behind their action, and deal with that, as opposed to just reacting to their poor behavior. What is it that's going on in their little brains that's causing that behavior? Because there's always something. And so I imagine as you go through the parenting journey, those challenges get bigger and bigger, different, I guess. And so by starting to practice early, you can kind of incorporate that more and more throughout the parenting experience, and also teach your children that skill set, which is huge.
Yeah. And one of the real supports in being able to name and know my own experience, which mindfulness really helps as a foundation for, is that not only can I know it for myself, but I'm able to name it out loud for my daughter, and to see what her behavior is looking like it's indicating, I'm able to name that for her, because they don't have words to know how to express it just yet. And even pre-verbal, like even when they're a baby, talking that out loud and saying, oh, that looks like that hurts, honey, or yeah, you're really angry right now, and it's frustrating when it's like that, it be able to name it. There's a man named Dan Siegel who does all kinds of work around parenting and neuroscience and some mindfulness work, and he coined the term name it to tame it. That the moment we're able to name our experience, that it allows the primitive part of the brain to become deactivated, and for the more higher functioning part of the brain that has some ability to reason to come back on board. Because trying to reason with someone who, that part of the, he does this thing with his hand, it's called flipping your lid, right? Like, this is the primal brain, this is your prefrontal cortex, goes over top, it's the one that can be more reasonable. So if your kid is out here and is in the amygdala, fight or flight, sort of state, like really highly reactive, trying to be reasonable, that part of their brain isn't even available. And I remember that teaching being so helpful for me when I first read it, that I just thought, oh, wow, because you're trying to make a toddler understand, and that it's not even available. So helping to name it for them allows that to start to come settling. And then when they're calm, right, and that connection is back, then you can name and explain it a bit more and say, it's not okay to, or, here's what you could do next time if you, that kind of repair. Is teaching what's called emotional intelligence, and having some language around feelings. So the best way to do that is, of course, to be able to do that within ourselves first, right? And then it's through the modeling of it for our kids again and again and again.
Yeah, we've kind of gone past the point that we were going to, but I think it's an excellent reminder of how we just need to continually work on ourselves and learn new skills, because none of this any of us have any training in parenting, pregnancy. No. Like, I mean, I have some medical training, you've got some but like, as parents, we all just figure it out as we go. And so the more we can do to work on ourselves to then help our kids learn, I think the better. Also, it's, as you said, mindfulness, it's a muscle that needs to be strengthened. It takes work to get to a place that you're actually using it regularly and effectively, I would imagine. And so by starting early in your parenting journey, you can, as your child grows, you can grow with your child, and your skill sets can grow with your child, so that when they're older and they're starting to be more challenging, you have a better skill set with which to manage.
Yeah. And if you're listening to this podcast, you're likely already postpartum, because when you're pregnant, you seem not to think much about postpartum. It's all about pregnancy and labor, right? But I so would love to, we should have this conversation with all the pregnant folks, because that's the time where you might actually have some time to be doing some of the formal stuff, such that you remember in the everyday moments of postpartum. Because my goodness, there's not like big chunks of time where everything. So here's the other thing I want to debunk about mindfulness, is that everything has to be perfect and calm and quiet for you to be able to practice mindfulness, because that just doesn't happen. It really doesn't. And it doesn't have to be long. And I know I had to reframe this for myself when I had Shay, because I'd already been having a practice and doing it a particular way for, years. And then now she's here, and now I can't get a half hour to myself or 45 minutes to myself, right? And where do I fit that in? And when I do have any window like that, I'm so exhausted that I'm doing something else, right? So just some tips around that is, it can be in the everyday moments of just while you're feeding your baby, right? Like whether it's with a bottle or breastfeeding, however you're feeding your baby, to just be feeding them, right? And to be really taking in with all of your senses, the felt sense of their warmth, where their body is touching yours, the feeling of their breath, the feeling of your body breathing, right? What you're taking in by sight, what sounds are around. Like, just even if you did that for 10 seconds or 60 seconds, or for the whole bottle or the whole feed, however you're feeding, right? Like that creates that attunement as well. Because it's so easy to be multitasking. And I'm not saying, because everybody's listening to me going, oh yeah, that sounds ideal. Like, when are you ever going to do that? Because normally you're doing a gajillion other things at the same time. And yes, that's true. But some of the time, that stopping and that pausing and just doing of the one thing, that in itself will be nourishing and a deep practice for yourself. And watch and see. when you're more nourished and attuned yourself, see if there's any reflection in how your baby is as well, right? So, because it's a feedback loop, right? Together. So, yeah, don't wait for it to be perfect is basically my message. And then the other thing is, as she got a little bit older, I kept trying to get away from her at bedtime. It's like, go to sleep. You know, this is even when she's a year and a half or two. Like, go to sleep because it's my time now to go and practice. Like, that was my window. I did it when she went to sleep because I would be at least not too tired and I could do it then. And then I realized, why am I trying to get away from her? I can practice right here. So I did it while I was putting her to sleep. And then it got to sitting on the end of her bed, you know, and then I was on my meditation cushion. Like she started having that as part of her bedtime routine. Actually, that's when mom was practicing. So just, those are just little examples of ways you can thread it into what you're already doing, as opposed to where could I possibly fit another thing into a day that already doesn't have enough time.
Great tips. Now, I'm assuming since you have such great tips, it's probably because you've been teaching this for a while. If people are interested in learning about mindfulness or mindfulness based stress reduction, right? MBSR, how can they find out more about that with you?
Yeah, so I have 3 different offerings that I have on the go right now. And because of the time that we're in, it's all online and by Zoom right now. And I'm going to carry that forward through the summer and the fall as well, just because we just don't know. And so for the foreseen future, it's all online, which on the one hand, you know, there's something about coming together in person, but on the other hand, it can be hard to get there. You know, we all know this in our parenting that, you know, you can just be in your bedroom. I happened to be at my office because it wasn't going to work out to stay at home. It was going to be too chaotic, but yeah, we can just stay in the comfort of our own home. So I've got monthly mindfulness sessions once a month on a Sunday from 2:30 to 4:30. We have some practice time. It's not dialogue. It's like going to a yoga class, except we're doing mindfulness. We're doing some sitting practice. We're doing some body scan work, some walking, and some very gentle sort of yin style yoga. I'm pausing for those through the summer, but they start again in September. And then I offer an MBSR course, which is mindfulness-based stress reduction. It's an 8-week program coming once a week, plus a commitment to half hour, 45 minutes of practice daily. So depending on where you are in your postpartum journey, I've got one postpartum mom, I don't know how old her little one is, who signed up for this summer session. I've got someone in her second trimester who signed up for this summer session coming up. So it depends where you are on your journey. And so that's running July and August, and I'll always have an 8-week series that's running and moving forward. It'll be on the website, the dates. And then in the fall, I'll be offering again a 6-week postpartum mindfulness course. It was being offered before in the public health units, but you know, things are all changing. I'm going to offer it online, and I don't have those dates there just yet. But you can look on the website, and the website address is www.elementscenter.ca. And you can see all 3 of those programs are listed there, and dates will be coming soon for the ones that will come up again in the fall.
Wonderful. Thank you. And we will make sure we post your site on our show notes below. So again, Stephanie, thank you so much for chatting with us today around mindfulness and how we can use it in our pregnancies, postpartum, or parenting journeys, or relationship journeys. It's so helpful in so many ways. And we look forward to chatting again soon.